Pharmacy is the science and technique of preparing and dispensing drugs. It is a health profession that links health sciences with chemical sciences and aims to ensure the safe and effective use of pharmaceutical drugs. The scope of pharmacy practice includes more traditional roles such as compounding and dispensing medications, and it also includes more modern services related to healthcare, including clinical services, reviewing medications for safety and efficacy, and providing drug information. Pharmacists, therefore, are the experts on drug therapy and are the primary health professionals who optimize use of medication for the benefit of the patients. An establishment in which pharmacy is practiced is called a pharmacy or a chemist. In the United States and Canada, drugstores commonly sell drugs, as well as miscellaneous items such as confectionery, cosmetics, office supplies, and magazines, and occasionally refreshments and groceries. The word pharmacy is derived from its root word pharma, which was a term used since the 15th–17th centuries. However, the original Greek roots from pharmakos imply sorcery or even poison. In addition to pharma responsibilities, the pharma offer general medical advice and a range of services that are now performed solely by other specialist practitioners, such as surgery and midwifery. The pharma often operated through a retail shop which, in addition to ingredients for medicines, sold tobacco and patent medicines. Often the place that did this was called an apothecary, and several languages have this as the dominant term, though their practices are more akin to a modern pharmacy. In English, the term apothecary would today be seen as outdated or only appropriate if herbal remedies were on offer to a large extent. The farmers also used many other herbs not listed. The Greek word pharmakeia derives from pharmakon, meaning drug, medicine, in its investigation of herbal and chemical ingredients. The work of the pharma may be regarded as a precursor of the modern sciences of chemistry and pharmacology. Prior to the formulation of the scientific method, disciplines, the field of pharmacy can generally be divided into three primary disciplines: pharmaceutics, medicinal chemistry, and pharmacognosy. Pharmacy practice. The boundaries between these disciplines and with other sciences, such as biochemistry, are not always clear-cut. Often, collaborative teams from various disciplines work together toward the introduction of new therapeutics and methods for patient care. However, pharmacy is not a basic or biomedical science in its typical form. Medicinal chemistry, on its own, is also a distinct branch of science of synthetic chemistry combining pharmacology, organic chemistry, and chemical biology. Pharmacology is sometimes considered as the fourth discipline of pharmacy. Although pharmacology is essential to the study of pharmacy, it is not specific to pharmacy. Both disciplines are distinct. Those who wish to practice both pharmacy and pharmacology receive separate training and degrees unique to either discipline. Pharmacoinformatics is considered another new discipline, for systematic drug discovery and development with efficiency and safety. Professionals. The World Health Organization estimates that there are at least 2.6 million pharmacists and other pharmaceutical personnel worldwide. Pharmacists are healthcare professionals with specialized education and training who perform various roles to ensure optimal health outcomes for their patients through the quality use of medicines. Pharmacists may also be small business proprietors, owning the pharmacy in which they practice. Since pharmacists know about the mode of action of a particular drug, and its metabolism and physiological effects on the human body in great detail, they play an important role in optimization of a drug treatment for an individual. Pharmacists are represented internationally by the International Pharmaceutical Federation. They are represented at the national level by professional organizations such as the Royal Pharmaceutical Society in the UK, the Pharmaceutical Society of Australia, the Canadian Pharmacists Association, and the American Pharmacists Association. See also List of pharmacy associations. In some cases, the representative body is also the registering body, which is responsible for the regulation and ethics of the profession. In the United States, specializations in pharmacy practice recognized by the Board of Pharmaceutical Specialties include cardiovascular, infectious disease, oncology, pharmacotherapy, nuclear, nutrition, and psychiatry. The Commission for Certification in Geriatric Pharmacy certifies pharmacists in geriatric pharmacy practice. The American Board of Applied Toxicology certifies pharmacists and other medical professionals in applied toxicology. Pharmacy technicians support the work of pharmacists and other health professionals by performing a variety of pharmacy-related functions, including dispensing prescription drugs and other medical devices to patients and instructing on their use. They may also perform administrative duties in pharmaceutical practice, such as reviewing prescription requests with medics' offices and insurance companies to ensure correct medications are provided and payment is received. A pharmacy technician in the UK is considered a healthcare professional and often does not work under the direct supervision of a pharmacist but, instead is supervised and managed by other senior pharmacy technicians. In the UK, the role of a PhD has grown and responsibility has been passed on to them to manage the pharmacy department and specialized areas in pharmacy practice, allowing pharmacists the time to specialize in their expert field as medication consultants, spending more time working with patients and in research. A pharmacy technician once qualified has to register as a professional on the General Pharmaceutical Council register. In the U.S., pharmacy technicians perform their duties under supervision of pharmacists. Although they may perform, under supervision, most dispensing, compounding and other tasks, they are not generally allowed to perform the role of counseling patients on the proper use of their medications. History. The earliest known compilation of medicinal substances was the Sushruta Samhita, an Indian Ayurvedic treatise attributed to Sushruta in the 6th century BC. However, the earliest text as preserved dates to the 3rd or 4th century AD. Many Sumerian cuneiform clay tablets record prescriptions for medicine. Ancient Egyptian pharmacological knowledge was recorded in various papyri such as the Ebers papyrus of 1550 BC, and the Edwin Smith papyrus of the 16th century BC. In ancient Greece, Diocles of Carystus was one of several men studying the medicinal properties of plants. He wrote several treatises on the topic. The Greek physician Pedanius Dioscorides is famous for writing a 5-volume book in his native Greek pi epsilon rho iota upsilon lambda eta sigma iota alpha tau rho iota kappa eta sigma in the 1st century AD. The Latin translation De Materia Medica was used as a basis for many medieval texts, and was built upon by many Middle Eastern scientists during the Islamic Golden Age. The title coined the term Materia Medica. The earliest known Chinese manual on materia medica is the Shenong Ben Cao Jing, dating back to the 1st century AD. It was compiled during the Han Dynasty and was attributed to the mythical Shenong. Earlier literature included lists of prescriptions for specific ailments, exemplified by a manuscript, recipes for 52 ailments, found in the Mawangdui tomb, sealed in 168 BC. Further details on Chinese pharmacy can be found in the Pharmacy in China article. In Japan, at the end of the Asuka period and the early Nara period, the men who fulfilled roles similar to those of modern pharmacists were highly respected. The place of pharmacists in society was expressly defined in the Taiho Code and restated in the Yaro Code. Ranked positions in the pre-Heian imperial court were established, and this organizational structure remained largely intact until the Meiji Restoration. In this highly stable hierarchy, the pharmacists, and even pharmacist assistants, were assigned status superior to all others in health-related fields such as physicians and acupuncturists. In the imperial household, the pharmacist was even ranked above the two personal physicians of the emperor. There is a stone sign for a pharmacy with a tripod, a mortar, and a pestle opposite one for a doctor in the Arcadian Way in Ephesus near Kusadasi in Turkey. The current Ephesus dates back to 400 BC and was the site of the Temple of Artemis, one of the seven wonders of the world, the home of Mark Antony and Cleopatra, Mary Magdalene, and where St. Paul read his letter to the Ephesians. In Baghdad, the first pharmacies, or drug stores, were established in 754, under the Abbasid Caliphate during the Islamic Golden Age. By the 9th century, these pharmacies were state-regulated. The advances made in the Middle East in botany and chemistry led medicine in medieval Islam substantially to develop pharmacology. Muhammad ibn Zakaria Razi, for instance, acted to promote the medical uses of chemical compounds. Abu al-Kashim al-Zahrawi pioneered the preparation of medicines by sublimation and distillation. His Libus Servitoris is of particular interest, as it provides the reader with recipes and explains how to prepare the "simples" from which were compounded the complex drugs then generally used. Sabah ibn Sal was, however, the first physician to initiate pharmacopoeia, describing a large variety of drugs and remedies for ailments. Al-Biruni wrote one of the most valuable Islamic works on pharmacology entitled Kitab al-Saydala, where he gave detailed knowledge of the properties of drugs and outlined the role of pharmacy and the functions and duties of the pharmacist. Avicenna, too, described no less than 700 preparations, their properties, mode of action and their indications. He devoted in fact a whole volume to simple drugs in the canon of medicine. Of great impact were also the works by al-Maridini of Baghdad and Cairo, and Ibn al-Wafid, both of which were printed in Latin more than 50 times, appearing as de Medicinis Universalibus Particularibus by Monsieur the Younger, and the Medicamentus Simplicibus by Abenguefort. Peter of Abano translated and added a supplement to the work of al-Maridini under the title De Veneris. Al-Muwaffaq's contributions in the field are also pioneering. Living in the 10th century, he wrote the foundations of the true properties of remedies, amongst others describing arsenious oxide, and being acquainted with silicic acid. He made clear distinction between sodium carbonate and potassium carbonate, and drew attention to the poisonous nature of copper compounds, especially copper vitriol, and also lead compounds. He also describes the distillation of seawater for drinking. In Europe, pharmacy-like shops began to appear during the 12th century. In 1240, Emperor Frederick II issued a decree by which the physicians and the apothecaries' professions were separated. The first pharmacy in Europe was opened in 1241 in Trier, Germany. In Europe, there are old pharmacies still operating in Dubrovnik, Croatia, located inside the Franciscan monastery, opened in 1317, and one in the town hall square of Tallinn, Estonia, dating from at least 1422. The oldest is claimed to be set up in 1221 in the Church of Santa Maria Novella in Florence, Italy, which now houses a perfume museum. The medieval Esteve pharmacy, located in Livia, a Catalan enclave close to Puigcerdà, is also now a museum dating back to the 15th century. Keeping albarellos from the 16th and 17th centuries, old prescription books and antique drugs.